Hi everyone, my name is Alex Horn, and my research question is, are providers satisfied with their EHRs, and is there a correlation between provider EHR satisfaction, quality patient care, and quality documentation within the EHR? To answer this question, I will investigate as to why providers are satisfied and dissatisfied with their EHR system, if there are systems that have a higher satisfaction rate than others. For example, is Epic a higher satisfaction rate within providers than Cerner or Meditech, or vice versa? If How can satisfaction be increased with these systems within providers? What would they like to see change? What doesn't work? What does work? What works within their workflows? If EHRs hinder or enhance the provider's workflows, and how that could be changed, and how that affects satisfaction of the EHR. And research to find out if the provider's satisfaction within the EHR correlates with quality patient care and quality documentation within the EHR. So, of course, quality patient care would need quality documentation. So, when a patient goes to a doctor's appointment, goes to the ER, whatever, they know what happens, what the next step of their treatment plan is, etc. I did find some articles while researching these questions, but I still believe this topic is important because we're now living in a world where a terrible pandemic has occurred, which we all know about, and it has been really impacting our healthcare system globally, but especially here in the United States. And I think since we are living in this post-pandemic world, if we could even call it that, opinions on all aspects of healthcare have probably changed and changed drastically. From a provider's perspective, from a patient perspective, from a healthcare payer perspective, they've probably all changed, these opinions. And opinions on their EHR systems are included in that. And so I think quality healthcare can happen when providers are able to do their jobs and are able to be satisfied with their systems. And I think if they don't like their EHR system or they have issues with it, then those need to be identified so the patient can receive the best care possible and providers can do their job efficiently, safely, and effectively. My idea to achieve this research and to answer these questions are to create a survey with targeted questions regarding providers' EHR systems, how the EHR impacts patient care, what tools and workflows they use within the EHRs, what issues are there in the EHRs and their causes, what aspects of the systems do providers like, what do they not like, etc. So through this survey data, I will be able to answer my question, my overall research question, and provide additional details about certain EHR systems, as well as what can be improved in their systems. So it's really just to get an idea of if providers are satisfied, if they're dissatisfied, what their opinions are, because they matter. I personally believe that providers' opinions on EHR systems have drastically changed since the beginning of the pandemic, and that providers see them as a more useful tool regardless of their flaws than they have in the past. I know personally from working with some providers, this was before the pandemic, they felt like it just didn't integrate into their workflow effectively. There were issues, but I feel like these opinions have changed since the pandemic because our healthcare system has essentially had to completely change, and just everything has to change. So I think this survey, specifically would probably show that the telemedicine function and, being able to chat with your patients and to change how you provide care would be a big piece of satisfaction, or I could be wrong. And the patient portal function could be a big satisfaction, and with these functions as well. Being able to communicate between provider and patient, patients being able to tell providers what's going on, if they need medication refills, but without having that contact, the face-to-face contact that the pandemic has prevented us from having. So that's my research question. Please feel free to critique and just give your opinion on it. And if there's any other clarifications or questions, please let me know. Thanks.